Dr. Cimikoski joining me now on the show from Utah Stem Cells Joint Treatment and Wellness Center. It's warm outside, so many of us getting back out there and maybe feeling aches and pains from last year that we didn't take care of. Well, you have the fix, and it's such an interesting treatment. Tell us about it.
You're right, Nisha. Thank you for having me. We all get excited when the weather starts to warm up, and we think about all the fun sports and activities we want to do. And there's great hiking in Utah. I, for instance, enjoyed that 22 inches of fresh powder we had at Snowbird. So
did you ski?
I did. It was wonderful. It made my season. But you know, it's funny that we are transitioning into spring right now, even though we get these little cold spells. And so many people like to enjoy sports. A lot of people are my age. I just turned 50, and they're starting to give up doing the things that they enjoy. A lot of times it's because arthritis is catching up with them. You know, arthritis is a wearing and tearing down of the cartilage. As we age, we all get it, but some of us suffer from problems from arthritis and some of us don't. It's really dependent on the patient's chemistry and the way that the nerves interact, but we don't have to put up with that. We don't have to succumb to the arthritis and deal with pain or limitations in our activities.
What areas are you talking about? What are patients coming in and saying? Is it knees?
You know, knees are the most common ailment that people have when we talk about joint pain. I do treat more knees than any other joint, but I treat lower backs, necks, shoulders. A lot of people get rotator cuff tendonitis, for example. All of these things can be healed with stem cells. Stem cells have amazing regenerative properties that can actually become the new damaged tissue that is ailing you. It becomes new cartilage, it becomes new tendons and ligaments, and we can effectively and permanently heal things that are hurting you, and you don't have to put up with limitations on the activities you want to do. And for a lot of my older patients, they just don't want to be suffering from pain on a constant daily basis.
We're not talking about surgery right now.
Right.
This is different.
So there's no need for any risky surgeries or knee replacements, hip replacements. So many of my patients have been told they're good candidates for a joint replacement. But we just inject stem cells and platelets. Stem cells are the cells that actually become the new cartilage and new damaged tissue. And platelets, platelet-rich plasma, they have all the growth and healing factors. And together we can actually regrow and heal, remanufacture, if you will, the tissue that's now damaged.
This is the future. This is the future of healing and the difference. How quickly do you feel a difference in your joints?
You know, thankfully, the treatment itself only takes about an hour for one joint. And you get on with your normal activities right afterwards. There's no downtime. And you have to be patient for about 5 weeks, which is not a horrible amount of time to be patient. And during that time, you can do all your normal activities. But at the 5 to 6 week mark, you'll get about 70 to 80% of the improvement. It takes a little time for cartilage and tendons to heal and regrow. And then over the next 3 weeks, you'll still continue to heal. You'll get the remainder of the healing at about 8 to 10 weeks.
Do you need more than one treatment sometimes?
Well, you know, about 60% of the time, when I do one treatment, that's all that's required. And about 40% of the time, you might need 1 or 2 follow-up platelet treatments alone. Platelets you can think of as like fertilizer for the lawn. I know you had a segment earlier about fertilizer. I use the analogy of stem cells are like the grass seed, and PRP, platelet-rich plasma, is like the fertilizer. Sometimes you might need a little bit of fertilizer to just help things move along. But about half the time, a little bit more than half the time, we only need to do one treatment and you're finished.
What are patients saying to you? Are they shocked with the results? You
know, I have so many grateful patients, and some of them are shocked. Some people are skeptical. They come in and they tell me they've got bone-on-bone arthritis, that my joints are too bad. The orthopedist told me I need to have a knee replacement. And it's amazing that even older folks with bone-on-bone conditions can improve. And I get younger patients, too, that are suffering from really bad conditions in their ankles or rotator cuff, things like that. And they've given up hope. They're not surgical candidates, many of these people, and they think that these are ailments they have to deal with forever. And when they come in and they see me, the most rewarding thing that I do is see people back 5 to 6 weeks later to see how they're doing. And it's one success story after another.
Well, it's life-changing with that pain gone. I know our Devin Lucy just came in the commercial break and said, I hurt my knee skiing. What can I do? Well, this is the guy to see. And there, if you would like to see him, we want to put all our information on your screen and also on our website, utahstemcells.com. There's a phone number right there. You can get a free consultation and a $300 gift certificate for you and a friend or family member. If you hop on there or call today, that is their website. Go to ours and we'll link you to all the information. Dr. Cimikoski, so good to see you.
Thank you very much, Nisha.
Bri, coming up.